Good day. My name is Dr. Christopher Chang, and I'm a primary care physician working in Trinidad and Tobago. The topic of discussion today will be focused mainly on diabetic neuropathy and diabetes foot care. So according to the International Diabetes Federation, the prevalence of diabetes in adults living in Trinidad and Tobago stands at 12.7%. This means that 1 in every 8 adults have diabetes, and this number is predicted to rise to 15.4% in 2045. These are alarming statistics, and much more needs to be done on diabetes awareness. Diabetes is a non-communicable disease where your blood glucose levels are too high. Over time, this can lead to detrimental complications in the body, such as macrovascular, that is affecting the large blood vessels, leading to stroke, heart attack, and peripheral artery disease, and microvascular, affecting the small blood vessels in the eyes, known as retinopathy, in the kidneys, known as nephropathy, and in the nerves, known as neuropathy. So today, we will be discussing mainly diabetic neuropathy and diabetes foot care. Right, so let's jump straight into it. Diabetic neuropathy. What is diabetic neuropathy? Diabetic neuropathy is the most prevalent chronic complication of diabetes. It is damage to the nerve fibers due to diabetes. There are 4 different types. Peripheral neuropathy, where there's nerve damage that affects the feet and legs, as well as the hands and arms. Autonomic neuropathy, damage to nerves that control the internal organs. Focal neuropathy, damage to a single nerve. And proximal neuropathy, a rare and disabling type of nerve damage to the hip, buttocks, or thighs. The most common of them all is peripheral neuropathy, where the nerve fibers to the feet and legs are affected. Approximately 40 to 50% of persons with diabetes will have detectable neuropathy within 10 years. Individuals with diabetic neuropathy can lead to foot ulcers and amputations, as seen in the picture, neuropathic pain, significant morbidity and psychological effects, and increased use of healthcare resources. So what are some risk factors for diabetic neuropathy? Well, elevated blood glucose levels, elevated blood pressure, dyslipidemia, especially elevated triglycerides, being overweight or obese, which is indicated by increased body mass index, right, or increased BMI, smoking, and excessive alcohol consumption. So what can be done? Well, we need to control the risk factors. And in doing so, we can intensify glycemic control by adjusting medications for tighter glycemic control. We need to control our blood pressure, aiming for blood pressure readings less than 130 on 80. Lifestyle changes, which include physical activity, at least 30 minutes a day and 5 days for the week, as well as dietary changes, low-salt diets, low-fat intake, smoking cessation, and decreased alcohol intake. 2, we need to have regular diabetes foot care at home, which we will discuss later on. You need to visit your healthcare providers for regular checkups, because once diagnosed with diabetes, screening for diabetic neuropathy should be done annually. If you are experiencing any of the following symptoms, such as loss of sensation to the feet and toes, sharp shooting pain down the leg, burning or tingling, feelings described as pins and needles, and numbness, you may need to seek medical attention, as these are signs for neuropathy and needs further investigations and treatment by your doctor. So, diabetes foot care. Diabetes foot care is essential, as diabetes can be dangerous to your feet. Even a small cut can produce serious consequences, as we would see later on. This is because diabetes may cause nerve damage that takes away the feelings in your feet. As we mentioned before, this is a term called peripheral neuropathy. It may also reduce blood flow to the feet, making it harder for injuries to heal or resist infection. This could lead to infection or non-healing wounds that can put you at risk for amputation. To avoid serious foot problems that could result in losing a toe, foot, or leg, we advise that you follow these steps for good foot care. So when trimming your toenails, it is important to make sure that you cut the toenails straight across, leaving them long enough so that the corners lie loosely against the skin at the sides. Do not trim your toenails too short. Do not round the edges, as you can see on the image on your right-hand side. And also, do not try to cut the toenails into a pointy V shape, as this could lead to ingrown toenails that can later become infected. In caring for your feet, we advise that you wash your feet in lukewarm water daily. Be gentle and wash them using a soft washcloth or sponge. On drying,
Blot or pat and carefully dry between the toes. Moisturize your feet daily. This is to keep dry skin from itching or cracking. However, do not moisturize between your toes, as that can encourage fungal infections. Inspect your feet daily, checking for cuts, blisters, redness, swelling, or nail problems. Use a magnifying hand mirror to look at the bottom of your feet, and if you notice anything strange, call your doctor. Wear shoes that fit well. Avoid small sizes, as this can squeeze your feet and cause blisters. Inspection of your shoes is vital. Shake out your shoes and feel the inside before wearing. Remember, your feet may not be able to feel a pebble or other foreign objects, or even a hole in your shoe as seen in the picture. So always inspect your shoes before putting them on. And lastly, and most importantly, never walk bare feet, whether indoors or outdoors. Always wear a shoe or slippers that protect your feet. In summary, in caring for your feet, ensure you keep them clean by washing them daily, dry them well, especially between the toes, inspect your feet for any cuts, blisters, swelling, redness, or temperature changes, and don't forget to inspect the sole and between the toes. Lack of foot care can lead to detrimental consequences as seen in these pictures. You could develop a blister, a sore, dry or cracked skin, callus, ingrown toenails, and ulcers. This could lead to an infection or a non-healing wound that can put you at risk for an amputation. So in summary, although there is no cure, there are ways to effectively prevent or manage diabetic peripheral neuropathy. Proper foot care, including daily foot inspections, effective blood glucose control, and medications may help to alleviate nerve pain.
Thank you everyone for taking your time off and listening to this presentation. I hope it was very informative and you learned a lot from it and you were able to follow along with the diabetes foot care. Take care.